and we're smiling and we're smiling and finally we're live. Hello everyone, welcome and thank you for joining us this evening. We're still gonna probably wait a little bit to see for people to come and join us. But if you are joining us, welcome. And this evening is going to be a fun topic. I'm excited that we get to talk about this. Let me see if I can, there we go, there we are. Swipe in if you are joining us, say hi. Professor, we say at Jeff, we say swipe in like you do at the gym so that people can come and say hi. So, and I always say like they have to say hi because you don't go to someone's house and not say hello. So come and say hi so we know you're here. So come on in, people, join us, and let's have this conversation. So I said to you when we were off screen, and I wanted to share with everybody else, that we're taking the taboo out of talking about poo. And I'm sure if my children are hearing me from upstairs, they're going to have such a giggle because we're at that age now that every time we talk about poo, it's hilarious for them. And I think that's one of the things that we want to address, and how it is so funny that we as a society it's a taboo topic and we giggle about it and we don't talk about it. So hopefully tonight, Professor, you are going to help enlighten us and help inform us a little bit as well, so we can share this topic and just help people to not feel so embarrassed to talk about poo. So that being said, welcome everybody. If you're just joining us, swipe in, say hi. I see lots of people are joining us already. I saw a few Jeffers coming in. Hi guys. I am joined this evening by Professor Setshedi, and I knew I was going to say that wrong, Setshedi.
You did a great job.
Yes. And oh my goodness, we're so grateful that we get to have you this evening with your extensive experience on this topic, and for taking the time to come and talk to us about this, and just helping us to process some of these questions. And just for those of you who are not familiar with Professor Setshedi, she's currently a professor over at UCT, working at Grote Schuur, and specifically the chair and HOD of gastroenterology. And then her experience goes to the UK at Oxford University, and have been at UCT for many years. And I'm just so grateful that you've taken the time to come and talk to us this evening, because we feel like you are an expert, and we can learn from you this evening, and we just want to say thank you so much. So should we dive right in, or is there anything that you wanted to say on the topic before we kick off?
Well, thanks a lot for inviting me to talk. I do love to talk about things like this because, as you say, people find it embarrassing, and yet it's something that we should all understand and be able to talk about it because it affects each and every one of us. So very happy to be here. Thank you for having me.
Oh, such a pleasure. And I think, guys, if we start getting embarrassed about it, just remember, even the queen poos. Okay, so there we go. All right, so we're going to go straight into it. And one of the topics that we're going to talk specifically about in the gastro tract is constipation. What is constipation, and how do we accurately define this problem?
Sure, it's such a loaded question. Excuse the pun.
Excuse the pun.
It's broad, and if you were to poll many different people, you would get a myriad of different answers as to what constipation means for them. So you will get pain, bloating, discomfort. You will get not going often enough, to the bathroom. You will get, sometimes I feel like I haven't completely emptied my bowel. You will get, I get a sense of obstruction. You will get that I feel like I need to strain and push. And I mean, people will give all sorts of explanations as to what they understand it to mean. And in fact, even if you poll medical doctors, medical professionals, also they have sort of their own idea of what they think constipation is. So it is really a constellation of symptoms. It's not one thing. It's a couple of symptoms. And in order for you to qualify to be defined as having constipation, you need two of these things. So it has to do with the frequency. So if you are not having a bowel motion at least 3 times a week, you're constipated. It also has to do with the consistency. So if you pass very hard, pellety stools, that also is constipation. And then other symptoms include excessive straining, so pushing and struggling to pass stool, the feeling of incomplete evacuation, the feeling that something is stuck at the bottom. And then again, something that doctors don't ask and patients won't report is the need to use maneuvers to try and assist your motion. So whether it's pressing against your pelvis, pressing your tummy, even using your finger to evacuate. Some people even use objects. So any of these symptoms, if you have 2 of them, then we do define you as having constipation.
Okay. Well, that's very helpful as well, and it's good to understand that there's so many varying versions of it as well. That people aren't having the same symptoms.
Indeed.
Okay. Yeah. So then there is chronic constipation and occasional constipation. So what is the difference between the two?
I think that's a very important distinction to make. Most people will have experienced occasional constipation, and you know it because there's usually an identifiable trigger. Maybe you were traveling, or you were not as mobile, you're just post-op, you've had surgery, perhaps you've been started on some new medication, perhaps you've been stressed and have not been eating as well or drinking as much fluid. Maybe, so there is a reason why you might have occasional constipation, and even you as a patient might know that. And that the idea that should pass, it should be transient and it shouldn't last for a long time. So that's occasional constipation. Okay. Chronic constipation really refers to how long you've had these symptoms for. So if you've had these symptoms, the 6 categories that I've described, for a period of at least 3 months on an ongoing basis. Sure. And also despite trying sort of lifestyle and other things to improve it, that it's just not improving. Yes. And it's starting to affect your quality of life. That is what we would describe as chronic constipation. So it's a longer duration of really resistant symptoms that just refuse to go away despite, the non-pharmacological stuff that you're doing to try and help.
Yes. Yeah. Okay. Wow. That is, and the colon is such a important part of our gut health as well. So to be stuck. I am sorry, I cannot help it. There are so many puns. But to actually have the difficulty for so long, and the toxins and the gut health issues that it must cause is actually quite concerning. So what can then be some of the causes of chronic constipation?
Just to pick up on what you said about the colon, if you ask me, I think the colon is probably the most important organ of the body.
I agree.
I'm biased, I know.
No, but I have gone through this whole journey with my son who has all these gut issues, and we have found that when you focus on colon health, how much healthier someone is overall. So I totally agree with you.
And it's not just gut diseases. We now know that there's a definite link between dysbiosis or gut, the gut being unhealthy, with cardiovascular disease, neurovascular disease, all sorts of cancers, you name it. The source of the problem generally starts in the gut. So I think it's not an overstatement, to be quite fair. Okay. But to go back to your question, I think you're asking what were the causes of chronic constipation.
For chronic, yes. Yeah.
Okay. So the way we think about it is that there are secondary causes where there is an identifiable organic cause, right? Yeah. And then what we do is that we investigate for those causes. And if we don't find anything, then we will define it as what we call primary or idiopathic constipation. Okay. Now, the reason we do it that way is because if you can find a cause, which is a secondary cause, a lot of them are treatable. And so you don't have to live with this problem of chronic constipation forever and eternally. And you don't have to accept, the fact that your bowels are slower than someone else's. So the causes of secondary constipation, common things that everybody knows: drugs, a long grocery list of all sorts of medications, antidepressants, calcium, iron, PPIs, pain medication, antipsychotics, antiepileptics, lots and lots and lots of medications. One of the side effects is constipation. So it's a whole group of drugs that can give you constipation. And then the other big group are colonic diseases. In order to have a motion, you need for your colon to be functioning properly, to be getting the stimulus from the brain, to be contracting properly. You need the muscles to be working, and you need that there's no obstruction to flow. So you can't have a tumor there, you can't have inflammation, you can't have a nerve, something that we call a stricture, or a polyp, a large polyp, etc. Right? You can't have damage from radiation, which causes fibrosis and narrowing of the colon. You can't have a problem in the pelvis that again impairs defecation. So the colon, as well as the pelvis and the pelvic floor muscles, all have to be working well in a coordinated fashion. So colonic issues can give you constipation. And then neurological disorders. As I say, the gut communicates with the brain. So you need to perceive the sensation to have emotion. The gut needs to respond to that. The muscles need to respond to that in order to contract. So that needs to be functioning. So if you've had a motor vehicle accident and you have spinal cord dissection, or you've had a stroke, or you have Parkinson's, or multiple sclerosis, or any condition that affects nervous functioning, that can affect your colon. And then there's a variety of other, miscellaneous sort of conditions that can give you chronic constipation. So things have to work well at all levels in order for you not to have constipation. And then the other group would be metabolic disorders. So poorly controlled diabetes. If you have a hypo-functioning thyroid, so your thyroid is not working.
We find a lot of this in our industry.
Yeah. So that's something that you can easily test for and easily correct, and the patients do improve. And there are other metabolic disorders that can be looked for, that can be treated, that can also result in constipation.
Hormonal imbalances as well, hey?
Hormonal imbalance,
pregnancy and that
pregnancy. Yeah. But ideally, after you pop the baby, then hopefully everything should go back to normal.
But that's goodness.
So
push everything in every which direction.
It's a side effect of the bundle of joy that you're carrying, but after a while, it should dissipate.
Exactly. Eventually, it does move back into space. But I mean, it's actually quite common, as you know, for post-pregnancy because of an obstruction or something not going back to where it needs to go.
Just sorry to interrupt. So even with pregnancy, depending also on the number of pregnancies that you've had and how difficult the birth was,
how big the baby was,
the pelvic floor nerves might get damaged. So even after the baby, you may still have pelvic floor issues because either the muscles or the nerves were damaged if you've had an episiotomy, or if you've had multiple pregnancy, the pelvic floor becomes weakened, etc. So even after the baby, you may have problems depending on how difficult your delivery was and your obstetric history.
Exactly. Okay, cool. Thank you. That's very, very helpful as well. Okay, so one of the things is we're going into the festive season. So we want to make sure that people are considering and understanding how important it is to have good nutrition to help with their gut working properly. So any tips from your side that you would give to them going into the season for making sure that they do not deal with constipation? Because you mentioned already traveling, lack of hydration, especially when we're out in the sun and we're forgetting to drink. Any other tips that we can give people that they plan ahead to make sure that they don't, hurt themselves?
I mean, I think, I think you would agree that as a general thing, you should be watchful of what you eat, what you drink, exercising, etc. Just anyway. But as you say, going towards a holiday or festive season, we tend to be a little bit more lackadaisical about what we eat. But really what you can do is, continue to eat as healthily as you possibly can, increase your fiber intake. And fiber comes from leafy vegetables, grains, those sorts of things, right? If you can't get in as much fiber as you want to, there are fiber supplements that you can get, that you mix with water or juice or whatever that you can take to increase your fiber. So you want to increase your fiber intake to, they say, up to 25 to 30 grams per day. So that's quite a lot of fiber. So I think a supplement might be worthwhile. Otherwise, you really would be eating truckloads of spinach just to get you going, which of course is not practical. But healthy eating, well-balanced diet, greens, red vegetables, a nice mix of grains, beans, nuts, healthy living, fluids. I mean, fluids, you cannot overestimate fluids. And, people will say, oh, but doctor, I've been taking grains, I've been taking a lot of fiber, but I'm more constipated. The more fiber you consume, and it also depends on whether it's digestible or not, the more liquids you have to drink.
You need.
bulk up your stool, but it makes it dry.
Yes.
It worsens the constipation and the cramps and the bloating and whatever. So you have to lubricate. You have to drink lots and lots of fluid. And I'm talking 2 liters of fluids minimum. I'm not talking
We
alcohol.
didn't pay her, guys. We didn't pay her for this. She is saying exactly what we would tell you.
There you are, exactly. We wouldn't differ. I mean, I think it would be problematic if the 2 liters is in the form of alcohol, because that is only going to dehydrate.
Yes, true. Good point. It's a good thing that you're specifying. So we advise 2 liters of water per day. Yes, yeah, and minimizing caffeine, like caffeine earlier in the day, and then minimizing
caffeine, as you rightly said, because it's a diuretic. It'll dry things out. And then prunes have been shown to be as effective as some of the pharmacological treatments that we use. You need to eat about 8 or 10 per day, or whatever. The problem is that, I don't know about where you are, but here they can be quite expensive. Even prune juice is quite expensive. So you know, a lot of our patients that we see, they can't afford that. And then exercise improves gut health. It increases your colonic contractions. It improves anti-inflammatory properties and antioxidant properties. So it's just all around good for you, but definitely good for your gut health. And then you need a routine. You need to have a date with that loo daily or twice daily. You have to schedule it in. And the most severe contractions happen in the morning when you've just woken up.
Okay.
And then food also stimulates intestinal transit.
Yes,
so ideally you want to go
and exercise.
And exercise. So but ideally you want to go in the morning or after breakfast. And you need to go and schedule it and sit on the toilet and try to relax your external sphincter. Okay. But if you don't have action in about 15 minutes or so, what you should not do is that you should not sit there and strain and push and whatever. You should get up, walk around, go drink fluids, maybe have something else to eat in an attempt to sort of push things along. And if all that doesn't work, you can try to sort of assume a semi-squat position. So put a stool, get a little stool, and then put it on the floor and then lift your legs up. So you elevate your legs. So that your hip is actually above your anus. And what that does is that it actually straightens out the angle between the rectum and the anus. So by straightening it out, it actually allows for the stool to actually pass through. And if you think about it from an evolutionary point of view, people used to poop out in the open
in the wild, exactly. Yeah, exactly.
Right? Yeah, so the modern day ablution is fine for us, but actually it can be your enemy if you have chronic constipation. But you can try and alleviate that with the stool, or just sort of trying to elevate your legs and so forth. So and you need
to get a comfortable position. Get a comfortable
position. Yeah. And then you also need to heed the call. So women have been found to be a bit queasy about bathrooms, and maybe it's just because there isn't a good bathroom around the corner or whatever, and so they hold it in. The problem is that if you train your body to ignore, the reflex, over time you lose it. You lose that ability to sense it.
Yes.
So you can have a rectum full of stool that your body is not alerting you to the fact that actually there's stool in there and you need to go. So it's almost untraining what you learned when you were a kid being potty trained. So ideally you want to go when you feel the urge. Obviously, if it's socially possible to do so, but if not, then as soon as possible after it.
Yeah, that's so true. And that's what we were saying, traveling messes people up because people are not comfortable going when they're traveling because...
Absolutely. That's precisely why,
I have to say, that's something I struggle with. I'm gonna train myself to not do that, It
is difficult. And of course, you're eating different foods when you are traveling. So it's not
So we've been chatting so lekker. I haven't even looked at the comments. I feel so rude. I say to everybody to say hi, and I'm not even saying hi. Sorry, guys, being super rude. Let me just quickly check in and see who's here with us. If you're joining us, say hi. And if you have any questions, let us know. I think that's Sune is there. Let me just see who else is there with us. Antoinette is there. Hi, Antoinette. Thanks for joining us. Let me just check quickly over here as well. And guys, we're trying to take the taboo out of talking about poo. And we are trying to also empower you with the information so that you can make the decisions that are best for you, but also so that those of you who are moms and parents can help your kids from a young age to process this so that they don't learn unhelpful cues or unhelpful life skills that actually set them up for success so that they do not have to deal with this later in life. So let's just see any questions. So loads of people resort, this is Coach Jax that's asking this, loads of people resort to laxatives to have some sort of release. What is the recommended amount to have over a period of time without causing the body to become somewhat dependent on laxatives to have a release? And that is, it's like we asked Coach Jax to ask that because that was one of the questions that you and I were going to talk about. And can we just quickly, before we talk about laxatives, you and I just wanted to share a little disclaimer, for lack of a better term, is that we highly recommend that before you take anything that's going to help you, that you talk to your healthcare professional and make sure that you get the base that is the best for you, because we do not want someone to use this for the wrong reasons. We want people to use this for the purposes that it was intended for, and it can be harmful to you if you don't use it for the purposes that it was intended for, and you can actually cause long-term damage to your colon and gut. So please make sure that whatever advice we give today, you take that disclaimer that this is for chronic and for temporary release, but please do not use this for long-term if you not have your doctor's advice. So Professor, over to you to answer that question. So she put it up on the screen for us so we can actually see it. Thank Nix.
Well, thank you for that. I echo what you've just said, that really once you in the realm of chronic constipation, as I say, you've tried lifestyle measures to the best of your ability, you've maybe even tried over-the-counter preparations and it's not working, then really the idea is to go see a professional, and then they can try and diagnose what the specific cause is that's causing your trouble, and then be able to advise you on the right therapy for the right condition. So I think it's important to stress that. I think the other thing also to realize is that if for all your life you've had one bowel motion or two, so less than this prescribed 3 bowel movements per week, and you don't have any other symptoms, you have been well, nothing has changed, to realize that for you, right? I'm hearing myself.
I'm so sorry. I was trying to turn on the comments and then I actually turned on the video. I'm so sorry. Go ahead.
No, it's so weird to hear one's own voice.
Oh, I know.
It's weird. But the point is that there is a spectrum of normal for each and every one of us. So you really need to understand your own body well. So it may be that you don't need any intervention, that this is normal for you, albeit it's less than the so-called prescribed, minimum, because people are different and there's a wide spectrum of what normal is. But if you are concerned or there has been a change, and I think the issue is that there has been a change in your bowel motion, or you now have other symptoms, etc., then certainly you need to go see somebody. So once the non-pharmacological interventions have not worked,
yes,
what we say is that ideally you want to start with what we call an osmotic laxative. Now, osmotic laxatives, the way they work is that they draw fluid from the bloodstream into your colon. And by doing so, they soften the stool and therefore allow for easier passage of the stool.
Yes.
And patients are always concerned about long-term use, which is what this person is asking. Long-term use of laxatives, is it good? Can it do any damage, etc.? If you're talking about osmotic laxatives, because of their mode of action, if you have chronic constipation that requires a laxative on the daily or every second day or whatever, they really are quite safe to use. Amazing. The only thing that I would say is that if you have other comorbidities, so like renal disease, or you have hypertension and you are on medications to treat those, we just need to watch your electrolytes so that it doesn't shift your electrolyte balance. But in general terms, they're really, really safe. The ones that can be problematic are your stimulant laxatives. So these are the ones that increase colonic contraction.
Yes.
And those ones ideally are only used in a very acute situation where you're really, really severely constipated and you have pain and you're really unhappy. That can be used to relieve the constipation in the short term, and that's it. You use them for emergency care, but not for long term, because indeed those ones, through a negative feedback mechanism, can ultimately, if you use them long term, result in your colon being a little bit lazy. The other time is that we use the stimulant ones is that Some of them are used for bowel prep. If you're going to have a colonoscopy, because it's a short course, right? You can take a stimulant for bowel prep, for colonoscopy, and that's done. So for long term, clear it, and I'm happy. I don't want to do a colonoscopy that's full of poo. I mean, I love my job, but not a colon that's full of poo. It's just not So long story short, osmotic laxatives. So here we're talking about lactulose. We're talking about the macrogols. Those agents are fine if you need them for long-term use, but as I say, ideally prescribed by a practitioner. Stimulant ones, avoid them except for very, very short term, or if it's prescribed for you for colon prep. And then there's other things like Senna, which are also colon stimulants, which again can work for short term if you need it. That's also fine. Awesome. So I hope that answers the question that was asked.
Yes, absolutely. And actually, I think Coach Edgar actually had a similar question. What are some of the not so obvious signs that your gut biome is out of whack and needs intervention?
I like out of whack.
Yeah, that's the way Edgar talks though. There's Ed.
Out of whack. You could be having bloating, cramping, constipation. You could even have the opposite end of the spectrum, diarrhea, losing weight, gaining weight, skin rashes, pimples, mood disorders or mood changes. Yeah. I mean, it really manifests in all sorts of problems. It's linked to high cholesterol. As I said, it's linked to cardiovascular disease. It's linked to almost every disease that you can think of. So the obvious things would be those things that I've mentioned, and maybe even some things that you cannot detect clinically, but that you need a test or something to assess. So, yeah.
Amazing. Okay, cool. All right. So I think we've kind of addressed this a little bit, but I thought it would be good for us to also say, you just mentioned some of the various symptoms that people need to look out for. So when would it be advised for someone? So obviously we want to make sure that we exercise, we eat nutritiously and balanced, that we get enough hydration, and that we schedule and make sure that we take care of ourselves. Sleep is probably one of those as well, which is so important.
Yeah, absolutely.
And maybe like a lower sugar diet would probably also be part of that as well. So you're doing all of this, you've tried the intervention. So when would we need to go see a practitioner? Like, when is it that we actually make the appointment to say, okay, cool, I need to get some help now?
That's a really key question. So as you said, you've done all of that, it's not working, you've tried over the counter, it hasn't helped. You see a practitioner, it may be a general practitioner, maybe an internist, not necessarily a gastroenterologist. And so if you have these symptoms ongoing for months, so you are now chronically constipated, and you've tried lifestyle things that don't work, but in addition, you see blood. So rectal bleeding is not normal. And people will say, oh, it's hemorrhoids. Yes, it may very well be hemorrhoids, but we've done a study which shown that even people with hemorrhoids will have some other pathology, like a polyp or whatever, that also can explain the bleeding. So what you want to do is to have that checked out, even if you think it might be polyps, hemorrhoids, and even if it end up being hemorrhoids, but you want to make sure that you've excluded other serious disorders. So if you see blood, if you're losing weight, and by losing weight, I mean, obviously it's involuntary weight loss.
Yes.
Not on a
targeted normal weight loss that's controlled. Yes, exactly.
And significant in our terms would be 10% weight loss. So if you're a 60,
and no muscle gain probably as well, because that's the
indeed, yeah. So significant weight loss, so 10% of your current body weight. If you get diagnosed with anemia, right? So for whatever reason you had a blood test and your hemoglobin is low, you have anemia. Particularly iron deficiency anemia, always suggest that there's some kind of chronic blood loss, which could be inflammation or cancer or something else, right? So if you have anemia. If you have a family history of colorectal cancer, so colon cancer, and particularly if these first degree relatives had cancer at a relatively young age. I mean, we know that as you get older, your risk of cancer increases, right? But if you have a family history of people who've had cancer, colon cancer, in their 30s or 40s, 20s, whatever, that is worrying. In fact, you probably should have been picked up much, much earlier. But assuming that you hadn't been picked up until that point, that is a good time to actually go consult when you have constipation and you also happen to have this past history. Also, if for whatever reason in the UK they get sent fecal occult blood stool test. So you dip your stool in this reagent, and if there's blood, so sometimes the blood is not microscopic, you can't see it, but if you have a test that can detect microscopic or invisible blood, and then you have blood, that warrants you to be referred to be seen. And then so once you see a practitioner and you have these things, what we call alarm symptoms or alarm features, that warrants investigation. That's not the time to say, oh, my dear, this is just how your colon rolls, you're slow, live with it, or carry on eating the prunes. No, this is the time to do investigations.
Prunes is not going to do it.
So this is the time for this to be taken quite seriously, to be investigated, and hopefully for a cause to be found.
Sure. Thank you so much. I'm trying to see if there's any other questions. Guys, also over on the CIPLA side, thank you so much to CIPLA for sponsoring our little chat. And then thank you so much to you guys for dialing in on that side. I'll go check the comments afterwards to see if there's any questions, and I'm sure we can direct you to the answers as well. But thank you so much for dialing in, guys, and keep sharing those questions. There's a question that's just come in from Jillian. Let me just check quickly and probably pop it up on the screen as well. How effective are these colon cleansing things people do? So I'm wondering if she's talking about a colon cleanse, colon cleanses. And then, okay, so there's two different kinds. There's the home colon cleanses and then the store-bought ones as well. And then also going for colonics, which I'm assuming is another form of colon cleansing. So maybe we just need to distinguish between that. I've heard of crazy things like coffee in your bottom and the goodness. What else? What are your thoughts on these flushes? Okay, so we already just quickly distinguished. There are colonics, which is proper colon rinsing and cleansing, and then there is the home remedies and then the store-bought remedies. So what are your thoughts on these different ones?
No, that's quite a
loaded question. Yeah.
I mean, in some cultures, they believe in enemas for babies.
Yes.
And that is done, and it's cultural beliefs and
like a glycerine almost.
Like a glycerine, or sometimes it's hot water with salt or whatever, and they give the baby who's constipated or has some illness or whatever. So that's different. And then of course we talked about colonic cleansing agents for colonoscopy. Or for a radiology test where you need for the bowel to be clean.
Right.
And those ones are usually macrogals, or they've got PEG, which is a molecule that helps to cleanse the colon, and those are osmotic laxatives. So that's fine. I suspect this person is talking about those. They are the ones where you go to some lovely aesthetic place. Yeah. Spa, exactly. And I don't know, I have not been there myself, so I wouldn't know what they do, but what I'm told they do is that they do some colonic irrigation with some fluid or whatever, and then obviously you have a motion, and everything is clean, and it's good for weight loss and healthy feeling and whatnot. I must say, I'm an orthodox medical professional. I personally do not subscribe to these things. I think they are dangerous because the risk of perforation.
True.
So the risk of perforation with these catheters or whatever it is that is being used would concern me.
Yes.
And I think that it is likely, of course this has not been studied, but I suspect that removes all your healthy gut microbiota.
True.
And therefore it causes an imbalance in the balance of your good gut bacteria and your bad gut bacteria. And I think that is just, you're just creating drama, and then it's going to cycle where now your good bacteria is trying to populate, and then your bad bacteria has now got space, right, to grow and populate and so forth. So I think you're hearing me clearly. Personally, I do not subscribe to these things. I would be quite careful, and I would caution people against these things until there's evidence that they work and that they can be safely done, and what the benefits are. Other than what is purported,
Right. Yes, other than just obvious, but the long-term effects is what we want to be worried about.
is unknown.
Yeah.
But I think that the biggest thing is the risk of perforation.
Perforation, yeah, absolutely. And especially there, because we don't want septicemia and all the rest that can happen as well. So, yeah. Okay, well, thank you, Jill, for asking that. I love Jill, by the way. She was incredible. She took me skydiving, so.
I love it.
Guys.
And I said to Jill, take your coffee like everybody else does. Per us.
Yeah, exactly. Because it does help. It does help keep things moving. You just don't want to do too much of it, because then you again, like everything
but it
in
does
yeah. Okay, well, awesome. Thank you so much, Professor. I really enjoyed this. You are a fun person to talk about this. And not only because you have so much knowledge and you help us to digest, in a lot easier. And also, yeah, just to make us comfortable talking about this without feeling, that this is a taboo topic, that we can actually help educate people around us as well. So thank you so much. And thank you to everyone who has dialed in. And yeah, we will see you guys next time for another fun topic. But thank you so much, Professor, and all the very best to you.
No, thank you so much. And really congratulations to you and your team for hosting, as I say, what I think is really an important topic. So I hope everybody enjoyed it.
Yeah, I agree. I when I first saw it, I was like, are they sure they want me to talk about this? And then the more I processed it, with everything that I've been through with my son and with gut health, I think we need to talk about it more. We need to help people so that we're equipped and empowered. And I think it's super, super important. So thank you.
Absolutely. You're most welcome, Coach Tash. Lovely to meet you.
You too. Yeah, absolutely. Thank you, everyone. And we will see you guys next time. Bye.
Bye.